on any given day, there are almost 7,000 people with mental disorders in our jail in Los Angeles County. That's an embarrassing public health fact. That's more people than anywhere in this country, than anywhere in the world, in one single location with a mental disorder, and they're locked up in a jail. Something's gone wrong in society if that's true. And if it's happening right here in Los Angeles, whose responsibility is that if it's not the responsibility of the mental health professional community? So I'm the medical director for the Department of Health Services Office of Diversion and Reentry, where we're primarily working on removing folks who have serious mental disorders who are inside the LA County jail system, and through elaborate court processes, taking them out into housing, supportive housing, and clinical services. My sort of, I guess, professional career maybe began in my late teens as an activist, HIV activist, needle exchange activist. Prior to that, I was working in soup kitchens, always with homeless folks and just with vulnerable populations. Those were the days of ACT UP, and I sort of came of age in San Francisco in the late 80s, where we were, just doing a lot of things that were incredibly important, not always completely legal, like needle exchange and various protests and things. And, when I look upon systems, I look upon them in a sort of activist or sometimes a radical way. And I think system disruption is really important to change. That was a really impactful time that really brought our team, I think, even though we didn't all see each other as much, we were all actively working, and we were sometimes in parking lots vaccinating thousands of people. We were sometimes out at housing, even though housing was on quarantine. I'm thinking back to those really early days where we were literally right there on the front line in the jail where things were bad, in housing, congregate settings where we were scared. This was before there was a vaccine, and I wasn't sure if we were going to get sick. I wasn't sure if, in the very early days, it felt literally like the team was risking their lives. And I will forever be grateful for that. And we just have some incredible people who are so mission-driven and have such big hearts here. Actually, today it feels like a very similar time than the very beginning of COVID because of something large happening on January 1st where an entire population who has serious mental disorder, who are incompetent to stand trial on misdemeanors, are going to come out of the jail in a mass release on January 1st. And our whole team is scrambling right now to be there, to make sure they have a place to go. And that feels very much like COVID when we came to the jail with buses, taking temperatures, and bringing people to housing. We stood up very quickly. The very core of our work in the Office of Diversion and Reentry is against racism. We very consciously serve people of color as a priority. It's the core of what we do because that's who's in the jail. And our belief is that there's a better place for them to be. If you can support someone in housing, and housing, not a shelter, housing in the way that you would feel comfortable living in a particular setting, or housing in the way that you would feel comfortable having your family members be there, real housing, home, and good clinical care, that's our kind of approach against racism. Remove people from behind bars, open the gates, and bring them out into where they should be. When we looked at the general population of Los Angeles County Jail and compared it to those who are in the mental health population of Los Angeles County Jail, we also saw some racial differences that we could not turn away from, and we published a paper about that, which is, that the mental health population is significantly more African American. And so, when we saw that, we really wanted to make sure that that information got out there. We have a lack of doctors in the jail. We have a lack of doctors in this work, bringing people out of the jail. And any advocacy for more resources. What we do here in the Office of Diversion and Reentry only touches a small amount of the people that need our help. Though over time, we've been able to divert out of the jail almost that equal amount, 7,000 people since we began in 2015. There are 7,000 people still there, and for every person that leaves, a new person comes in. We simply still don't have enough resources. What I always say is that this work is not complicated. The things that any human needs are the same things that our clients or patients need. It is not hard to know that someone needs a safe place to stay, a family, a community, right? And good health care. It's really that simple. And it's actually much less expensive to set all that up than it is to put someone in jail at, the estimates are up to, $700-800 a day for people with mental health disorders. You figure all that in. The cost of simply housing someone and providing them with good clinical treatment is what's needed.